This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Apixator 2.5 tablet is an anticoagulant used to manage blood clots. It is crucial for patients undergoing surgery and those with specific heart conditions. Indications and uses. This medication is indicated for managing the formation of blood clots in adult patients following hip or knee replacement surgeries, as well as in individuals with atrial fibrillation who are at risk of blood clots. It is also effective for treating deep vein thrombosis and pulmonary embolism, reducing the risk of their recurrence in the legs and lungs. How it works. Apixator 2.5 tablet functions by inhibiting clotting factor XA, a critical component in the blood clotting process, thereby preventing the formation of harmful clots. Directions for use. It is essential to take this medication as prescribed by your healthcare provider. Swallow the tablet with a full glass of water. If you find it difficult to swallow, discuss alternative methods of administration with your doctor. The correct dosage and duration will depend on factors such as your age, weight, and the specific condition being treated. Possible side effects. Common side effects include bleeding from various sites, bruising, anemia, and low blood pressure. If any of these symptoms worsen, it is vital to seek immediate medical attention. Precautions and warnings. Patients with liver disease, active bleeding, or those who are pregnant or breastfeeding should avoid using this medication. It's also important to use caution if you are over 75 or have kidney issues. Always inform your doctor about any pre-existing conditions before starting treatment. FAQs. 1. Is this tablet a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any bleeding disorders or active conditions. 3. What if I miss a dose? Take it as soon as you remember unless it's almost time for the next one. 4. Can it cause low blood pressure? Yes, low blood pressure is a common side effect. 5. Is it safe during pregnancy? It is not recommended during pregnancy due to unknown effects. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your health matters, and we're here to help.